Good morning and happy and healthy 2021 with much emphasis on health. I'm honored to welcome the Central Westchester Geriatric Committee members and also the Westchester County Department of Senior Programs and Services Caregiver Collaborative. I am very fortunate to be a board member of the Central Westchester Geriatric Committee, and I also co-chair the Caregiver Collaborative. Today, it's a wonderful opportunity for both of these organizations, Central Westchester Geriatric Committee and the Caregiver Collaborative, to forces on this timely presentation, COVID-19 vaccine update. And we know this has really been a scary time. It's been frightening times, but there's also excitement in the air. And I know Dr. Barry Geller will speak to that as we now have vaccines that are able to combat that COVID-19. It is with great privilege and honor I introduce Colette Phipps, Executive Director of Livable Communities for Westchester County Department of Senior Programs and Services, and also our liaison for our Caregiver Collaborative. Colette, welcome.
Thank you, Jerry. And greetings from County Executive George Latimer and also from Commissioner May Carpenter. So just let me tell you a little bit about the Livable Communities Caregiver Collaborative. We are a robust partnership that presents a united voice to meet the complex social, medical, physical, financial, legal, spiritual, and emotional needs of caregivers. We validate caregiving and the challenges that caregivers face. We also seek to empower caregivers and the people they care for by helping them identify and access resources, provide choices, and we work to reduce barriers to service by developing award-winning and innovative programs for this very special population. We formed in the 80s. We were a group then. Then we were known as a group then a coalition, and now a collaborative. We meet monthly, and we always welcome new members ready to work on behalf of caregivers. So if you are interested in joining us, please, you can contact me. I'm at C like Charlie, A like Apple, P like Paul, the number 2, at westchestergov.com. Thank you so much.
So good morning, I'm Ellen Woods. I'm also co-chair of the Westchester Caregivers Collaborative, and I too am pleased to join with the Central Westchester Geriatric Committee, if only that it has more of us on this Zoom presentation and more of us have an opportunity to learn about COVID and the vaccines. There's a lot of information out there, and it's good to be able to hear from the experts. So with that, I'd like to introduce our speaker today. His name is Dr. Barry Geller. Dr. Geller received his undergraduate at Johns Hopkins University and went on to graduate from Einstein Medical School in 1995. He is currently the chair of the Department of Emergency Medicine at Phelps Hospital, Northwell Health, and is an assistant professor of emergency medicine at Zucker School of Medicine at Hofstra, which is part of Northwell. So thank you for coming today, Dr. Geller, and we're all looking forward to your presentation.
Thank you for those kind words, Ellen, and thank you for the opportunity to speak this morning. As has been mentioned, today's presentation will focus on COVID vaccines. However, I will be touching base upon some facts related to COVID in general, and also some information about the antibody infusion from Regeneron and Eli Lilly. We are going to hold the questions for now, and then at the end of the presentation, I'd be super happy to answer any questions that you may have. Feel free to put any questions you have in the chat area so you can sort of get your questions in the queue. Okay. I am. So the first slide is sort of about the state of the coronavirus in the world. In order to appreciate the magnitude of the miracle that we are experiencing with the vaccines, we have to really get a feeling for what the vaccine is trying to help us with. The numbers are just absolutely staggering. We've had worldwide over 100 million cases of the coronavirus, and tragically, this has resulted in about 2 million deaths. Unfortunately, even with the vaccine coming out and people getting inoculated, this number will continue to go up for the next couple months. A little bit of perspective about this virus compared to other viruses that we have faced historically, and that is that the bubonic plague actually caused about 50 million deaths, and the smallpox vaccine has caused over 50 million deaths. So this is an absolutely horrible virus, but sadly, the world has faced bigger challenges in the past. It is, however, one of our top 10 viruses as far as the mortality that it has inflicted upon the world. So we're going now a little bit more focused into how the coronavirus has affected us as a country in the United States. While the world has suffered over 100 million cases, the United States has had over 25 million cases. And this is really a disproportionate number of cases that we've had compared to the rest of the world. Some of it, though, may have to do with the fact that we do have better data than most countries. So it may be that we're really, in fact, just diagnosing more than some other countries are. We've also had over 400,000 deaths, and President Biden and his advisors feel that this number may go up all the way to 600,000 before we get control of this virus. The good news is that, as we can see on the right-hand side of this slide, the new cases are going down. Now, we don't want to let our vigilance down because we've seen this occur in the last couple of months a few times, but we can all pray that, in fact, the cases will continue to go down. A word of caution is that we're now dealing with some variants of the virus, some mutations. And I think that the popular press has done a pretty decent job with letting us know about the mutation and the variant from UK. That mutation is more transmissible, and it appears to perhaps be a little bit more lethal, but the vaccines, at least the messenger RNA vaccines coming out from Pfizer and Moderna, both have adequate coverage against this mutation. On the other hand, we are less comfortable with how strong the protection will be against some of the mutations coming from South Africa. And in the last couple of days, there's been more talk about a mutation from Brazil. So we'll see. On the other hand, these messenger RNAs vaccines can be fairly easily altered to actually keep up with some of the mutations. So that'll be interesting as we see what happens down the road. So we know what's going on with the world. We know what's going on in the United States, but let's get even more local than that. Let's see what's going on in, at least in my backyard, in New York. New York is unfortunately the state with the most deaths in the United States. That is, we've had over 1 million cases. We've had 42,000 deaths, but again, this number is going down for now. So let's pray that that continues. So now that the scale of this COVID-19 pandemic is illustrated through some numbers, we now begin to talk about what we've done about it as a nation. Pretty early on, the government recognized that this is a once in a lifetime pandemic and that we need to combine forces between the public sector and the private sector. And we have dubbed the operation as Operation Warp Speed. Operation Warp Speed is a collaboration between actually HHS, the Department of Defense, as well as pharmaceutical companies, distributors, and even FedEx and UPS, who are acting as the way for us to get the vaccine to all the many places that need it. This is actually an unprecedented effort by the government to help with the development and distribution of the vaccine. And it has been, in my mind, a success. It hasn't been a success. It hasn't been as successful as we would like it to be, but we are well on the way to doing a great job with vaccinating our nation. So while we had hoped that we would have at least 20 million vaccinations available to us, perhaps even before January, we are about, in my mind, probably 4 weeks behind schedule. And this slide really reflects many things that I'd like to point out. This slide talks about the fact that 20 million Americans have been vaccinated. I'm happy to say that this slide was taken a few days ago, and now, according to the Bloomberg vaccine tracker, we're actually up to 25 million. So 25 million Americans have been given at least one vaccine. About 4 million Americans have been given both vaccines, and about 50 million doses have been distributed nationwide. We are going at about a clip of 1.2 million vaccines per day. And I know that President Biden has said that he would like for us to accelerate the pace and get to about 1.5 million vaccinations a day. This is a very lofty goal, but it appears that we're doing a very good job, despite some setbacks. But overall, the vaccination drive is going very well, especially when you compare us to other nations. A little bit surprisingly is what states have been doing somewhat of a better job, let's say, than other states. And this doesn't have to do with the state itself. It could be with the way it was distributed. But Alaska, New Mexico, and West Virginia are leading the nation in terms of what percentage of their state they've been able to get vaccinated. Overall, though, the average in the United States as of today is that we vaccinated about 8% of our nation. 8% of our nation has gotten at least one vaccine, and a little bit over 1% have had 2 vaccines. So far, so good. Of course, we'd all like for the pace to be accelerated, but this is a monumental task, and we are rising to the occasion. Before I speak about the actual vaccines, I wanted to go through some terms which I think will be very handy to get a little bit of a deeper understanding of what they mean as I go through them, and as we perhaps discuss some questions that you may have. I'm not going to read the slide. I'm just going to start speaking about some of the terms that are listed. In order for a vaccine to be ultimately approved by the FDA, it has to go through a rigorous process. I want to emphasize that this vaccine has gone through, or when I say this vaccine, I'm actually referring to the 4 vaccines that I'm going to be discussing today. But the 4 vaccines that we'll be speaking about have gone through tremendously rigorous tests and have gone through all the normal phases that any other vaccine would undergo. The first phase is to try the vaccine on a very small number of people, up to 100 people. And that's basically just to establish in very broad terms, is it safe? What type of side effects does it have? and whether or not different doses of the vaccine will give different types of side effects. It also will measure what type of immune response is being generated. Phase 2 includes all of the things that I spoke about in phase 1 and adds to it a little bit more information. And it does so by involving now hundreds of volunteers. At this point, we're able to see what the most common short-term side effects are, how the body is generating the immune vaccine, and is it in fact protective or not. Phase 3, that's the fun phase in my mind. That's when we give it to lots of people. We give it up, for us, the vaccines that we're going to be speaking about, we've given it up to 30 or 40,000 volunteers. And now we see how people do when they get the vaccine versus the people who don't get the vaccine. And we also get to see how protective it is in any individual. Once all those phases are completed, and again, those phases were absolutely completed on all of these vaccines, there's phase 4. Phase 4, hopefully, is the approval phase. For the vaccines that we're going to be speaking about, the FDA has not given its final approval. It has given an interim approval, which is called the EUA, the Emergency Utilization Authority, and that gives it the ability for us to use it. The EUA is only applicable when there is a public health emergency declaration. And in fact, there has been such declaration, which is why we can give the vaccine the preliminary approval of the EUA. This slide, in my mind, is a very pretty slide. It may look complicated, but I'm going to try to talk through it and kind of explain in what I think are very easy to understand terms what the messenger RNA vaccine is. Most of us have not heard about, this concept of a messenger RNA vaccine, and because it's a newer technology, it has given pause to many people, and it has also elicited a lot of questions about the safety of the vaccine, which I will be addressing. So just to talk a little bit about the messenger RNA, which is the vaccine that both Moderna and Pfizer have produced, we see that we're able to isolate the messenger RNA that is responsible for the production of these pretty spikes on the outer shell of the virus. The scientific community has chosen the spike as the target for the production of the vaccine. Once the messenger RNA is produced, it is encapsulated in essence by a fat globule. This fat globule serves to protect the messenger RNA. It makes it a bit more stable, and also it makes it able to enter the cell without getting destroyed. So it gets in there. Once the messenger RNA is in the cell, it's able to take over the cell's machinery and produce spike proteins. You produce about 3 of these spike proteins and you get a spike. Once the spike is produced, it floats around the cell and eventually gets to the outer shell. Now we have all these cells with these spikes. Again, it's important to note that the virus, the coronavirus, has never been introduced into the body. One tiny part of it, the spike, has been artificially generated. It has been, we got it into the cell. We were able to get it to sort of look like what the virus looks like in some way. Only the spike portion though, and the spike portion does not cause any type of disease. Once the spike is present, the body starts to notice it. And this immune response that occurs generates these Y-shaped antibodies. And that's what we are going for. The Y-shaped antibodies play a major role in protecting us, as do other types of cells. But when we speak about the vaccine, I think it's important to note that we are ultimately going after these Y antibodies. What these Y antibodies do is that they cling onto the spike. So they get onto the spike, and therefore the virus is unable to enter any cells. It's basically covering up the way for the virus to do its damage. So that's the messenger RNA. And again, the big difference is that we're using RNA encapsulated in a fat globule to enter a healthy cell. It enters the cell, it makes the spikes. The spikes are able to generate the immune response. And that is a process called active immunity. I want to differentiate the messenger RNA vaccines from the viral vector vaccines, which are a much more traditional technology for vaccines. The viral vector vaccines, and those are the ones by Oxford AstraZeneca, as well as Johnson & Johnson, are vaccines that modify the adenovirus, and that's a very common virus, better known as one of the viruses that causes the common cold. So it modifies it so it's not able to replicate. They put, instead of RNA, they put the DNA of the spike protein. They put the DNA in the virus. The virus goes into the body, goes into the cell without being able to replicate, releases the DNA into the cell. The DNA goes into the nucleus of the cell. There, the messenger RNA is produced, and the rest of the cascade is exactly the same as the messenger RNA vaccine. In other words, the messenger RNA hijacks the cell's machinery, produces the spike proteins. The spike proteins migrate to the edge of the cell, and the body recognizes this as an intruder and produces antibodies. A kind of simple and perhaps easy way to think about this is that imagine that there's a problem with a bully in school, and the police bring around a picture of the bully to the school, and the safety officers take a look and they recognize the face of the bully. Once the bully comes around, the safety officers are able to see it, recognize it, and take action. And that's sort of the same way that the vaccines prime the body to react against the foreign intruder. In this case, it's the coronavirus. Moving on to some other concepts and vocabulary related to vaccines. We hear a lot about the vaccine causing an allergic reaction. An allergic reaction ranges from mild to severe. The more severe allergic reaction are called anaphylactic reactions. These are types of adverse drug reactions. Adverse drug reactions are different from side effects. Adverse drug reactions are unintended reactions from the vaccine, while a side effect would be more unwanted. So some of the unwanted side effects that we have been seeing with the vaccines include fatigue, headache, muscle pain, joint pain, fever, pain at the injection site, so on and so forth. And we'll get to discuss them with a little bit more depth in the next couple slides. This is incredibly important to keep in mind because whenever we give vaccines, this is the Holy Grail. The Holy Grail is that we want to produce a vaccine that is good enough to confer herd immunity. Herd immunity occurs when there's a big enough proportion of society that has the immunization, and therefore the process of infecting is disturbed. In other words, even when there's somebody who has the virus, they're unable to pass it along. And different viruses require different percentage of the country or of the world to be vaccinated in order to get herd immunity. With this virus, because it's increasingly transmissible, the percentage has been constantly and consistently going up in the mind of the scientific community. So right now, the last thing that Dr. Fauci has been speaking about is really trying to get 80% or higher of society immunized in order to get herd immunity. Once we have herd immunity, the virus will no longer be able to propagate. it'll sort of, it won't go away in my opinion, but it will become sort of background noise. Emergency use authorization is when the FDA says that it's okay to use the vaccine because there's a public health emergency. The biggest difference in my mind between emergency use authorization and FDA approval is that we don't have yet, let's say, even 6 months of long-term safety data, and therefore the FDA has not given its approval. The FDA will give its approval at the right time because these vaccines are tremendously safe, they're tremendously effective, and they will be getting FDA approval as time goes on. It's just a matter of the requirement that time passes by. And now to speak about the specific vaccines. I'm going to concentrate this talk on 4 vaccines. Some of them are better known than others. I've been mentioning the 2 messenger RNA vaccines coming from Pfizer and another in collaboration with a small company, BioNTech. Then there is Moderna. The virus-based vaccines, which are DNA vaccines. I'll speak about the ones that are being manufactured by Oxford, AstraZeneca, and Johnson & Johnson. A little bit of granular detail about the Pfizer vaccine. It is a messenger RNA vaccine. You do need 2 doses in order to get complete protection. You need to wait 3 weeks, at least 3 weeks between the 2 doses. You can get the dose a tiny bit early, 4 days early, but you also can get the vaccine up to 6 weeks after the first one. And this is actually a pretty recent pronouncement by the FDA and the CDC. However, you do need both doses to get the maximum effect from it. How effective is it? It's a miracle. 95%, unheard of, phenomenal, extraordinary. This is something that I can't overstate as to how impressive it is that it's actually able to be 95% effective in stopping the transmission of the virus. And the number is even higher when you look at how many people, of the 5% that the transmission occurred, it is essentially negligible, the people who had severe disease from the virus. You do get side effects, as we all know. There's no such thing as a free lunch. You often get pain at the injection site. And after the second vaccine, some of these are more common. So it's not unlikely that many people who get these vaccines will have some side effects. These side effects will last 24 to 48 hours at times. They are considered mild, even though they can knock you out for a day or 2, that's for sure. But the price is certainly worth the admission. Now, there is a difference between the time that you're getting the vaccines and until the time that you're fully immune. For Pfizer, you have to wait 1 week after the second injection to get full immunity. So if you get it with the shortest time interval of 3 weeks between the first and the second, after 1 month, you'll be completely immunized. And now, and later on, we'll speak about what that'll mean to the individual and to society when we're immunized. Its sister vaccine from Moderna is also messenger RNA. You also need 2 doses. The 2 doses are, instead of 3 weeks apart, they should be given 4 weeks apart. On the other hand, similar to the Pfizer vaccine, you can give it up to 6 weeks apart. And also similar to the Pfizer vaccine, you need both. The efficacy is actually slightly less. I rounded up to 95, but the real number is 94.1. Still incredible. Again, simply a miracle. The only side effect that I want to speak about that is a little bit different with Moderna is that you sometimes can get swollen lymph nodes near the area of the vaccine. So for most of us, that would be in the axilla or the underarm. It's interesting, it doesn't confer any danger, but that's an unusual side effect for us to know about. The time to full immunity is 2 weeks after the second vaccine. So if you get the vaccine as soon as you can with the shortest intervals, after 6 weeks, you're fully immunized. Moving on to the viral vector vaccines, and both companies have chosen the adenovirus in a modified fashion. These are the DNA vaccines that we're more used to. The AstraZeneca vaccine is also 2 doses. It has to be 28 days apart or so. You do need both. The efficacy is less, but I don't want anyone to think that this is an inferior vaccine, because in fact, while it's only, so to speak, stopping 70% of people from getting infected, those that did get infected, almost none of them had serious problems with the virus. And to be honest with you, while, you know, I guess it would be great for nobody to get the disease, we're not so worried about stopping people from getting the disease. We really want people not to get sick from the disease. So this is going to be a major player in vaccinating the rest of the world. The reason this may be a little bit less familiar to you is that we have not been using it yet in the United States. It is really, at this point, mainly being used in the European Union. And unfortunately, there's been a little bit of delay with the production. There's been a little bit of irregularities with the clinical trials, which caused some delay. But I believe that in the next few weeks to few months, this is really going to ramp up. Johnson & Johnson is very exciting, and it's the only vaccine that we're going to be speaking about that is able to confer the immunity that we are looking for with only 1 injection. The other incredible thing about this is that Johnson & Johnson and AstraZeneca, their vaccines can be stored in a good old refrigerator. The messenger RNA vaccines are unstable, and therefore they have to be kept in extraordinarily cold freezers. Not, in fact, the freezer that Pfizer requires, you have to be at minus 70 degrees Celsius. The temperature that's required for the Moderna vaccine is minus 20 degrees Celsius. So really the poorer nations and the more rural areas in the United States, that presents a big logistical issue. Johnson & Johnson, which we are hoping to get the data next week, we believe that the data will spur the FDA to give it the emergency authorization, and then the nation will be able to get vaccinated with Johnson & Johnson. I would be remiss in only speaking about vaccines, which is a way to confer active immunity, and not to discuss an incredible, exciting therapeutic that is currently being produced by both Regeneron and Eli Lilly. So I just showed you, utilizing some slides, how hard the body has to work to get the antibodies. Now, the body is rewarded for its hard work because once it generates the immunity, it lasts for a long period of time. How long it lasts for, that's an open-ended question. However, just in order to move along, I want to just speak about the incredible therapeutic that these companies have produced for us. And these are known as antibody infusion. So they've taken all the hard work that the body has already had to go through. I look at it almost as this is almost like the dessert. This is at the end of the day, they have given us what the body has worked so hard to produce, these antibodies. And if somebody has COVID and qualifies under pretty strict criteria, we're able to, at this point, infuse it over an hour, and it is able to dramatically decrease the likelihood of having severe disease. So this is a tremendous tool, which is underutilized at the moment because some of the complexities surrounding the actual logistics of giving it. However, 2 days ago, Regeneron released some data about this exact medicine, but in just an injection form. So while we currently have to give the antibody infusion over an hour and monitor very carefully, they've formulated it in a way that it looks like it's going to be more successful or as successful just by giving one shot in the skin. So a subcutaneous injection. So I really want to actually, for a moment, pause and let everybody know, whoever is on this call who's over 65 years old, if you automatically qualify if you are tested, if you test positive. And if you do so, I urge you to get in touch with your healthcare provider to let them know. And as long as you're not too sick, as long as you do not require either hospitalization or supplemental oxygen, you qualify for it. So I urge you to kind of store away this important piece of information for you or your loved ones, and to make sure that if you come down with COVID, that you know to contact your doctor or your healthcare provider and ask him or her if you qualify for this antibody infusion. Now that we have all these wonderful vaccines and we are getting more, who is it that the United States has decided will go first? As you can imagine, this is a controversial topic with a lot of consequences as to what these decisions really, how they were made, and who was chosen. I may be a little bit biased, but it certainly makes sense to me that healthcare personnel were considered to be an important group to get vaccinated very quickly, along with residents and healthcare workers who were in the nursing homes. As we know, the virus has been devastating to long-term residents, and therefore we were very eager to get them vaccinated and confer immunity. After that, we also included essential workers as well as people over 65. Initially, it was 75, but we've now saying that all the people over 65 qualify. This is over 100 million people, and as a result, we are temporarily facing a situation where we have more people who want to get the vaccine than vaccines that we have. But it is extraordinarily likely that within the next few weeks to months, our supply will be strong enough to vaccinate everybody who wants it. So who shouldn't get the vaccine? Well, for now, really, unless you've had an allergic reaction to the vaccine or to components of it, everyone else should speak to their doctor and find out whether they are suitable for it. It is, at this point, the children, anybody under 16, we do not have EUA for, but again, this is something that we'll talk about in a little while. Most of the country is eligible to get the vaccine. Why get the vaccine? Well, it has been eye-opening to see the number of people that have vaccine hesitancy. And as much as I'd like to give information, I really want to go strongly on the record and say that you should get the vaccine if you are in the eligible group. We'll have a quicker resumption of normal life. The community will be safer. You will be safer, and you'll help in establishing herd immunity. I'm happy to take questions, of course, about the safety of the vaccine as we come close to concluding the lecture. So now I'm going to run through a few questions, and then I promise to leave ample time at the end for people to ask any questions or voice concerns that they may have. So if you've had COVID-19, should you get the vaccine? Yes, you should. People get COVID in different ways. Sometimes the body generates a strong immune reaction. Even when it does so, we don't know for how long. And therefore, if you've had COVID-19, you should still absolutely get the vaccine. The antibody infusion, which I'm so excited about, once you receive it, you have to wait 90 days before you can get the vaccine. So even if you get the vaccine, had the misfortune of getting COVID, had the fortune of getting treated with the antibody infusion, then you would have to wait 90 days until the second vaccine. Very controversial. Can pregnant or breastfeeding women get the vaccine? The American College of Gynecology, which is the leading voice in this field, has stated clearly that pregnant women or breastfeeding women, it should not be withheld from them the opportunity to get the vaccine. The World Health Organization takes a slightly different view, and they recommend that only pregnant women who are high risk for suffering severe disease get the vaccine. I'm much more partial to the CDC and to our medical bodies as far as following their advice. A question that is reasonable on the surface is, hey, let's face it, 99% of people won't die from getting COVID. Why not just take a chance? After all, we don't know what's going on with the virus. Well, I'm going to challenge you with this question. Do you know anybody who has died from the vaccine? Extraordinarily unlikely that you do. On the other hand, do you know anybody that died from COVID? If you're lucky enough that you're answering no, I congratulate you. But for many of us, we know many people who have died or suffered tremendously devastating consequences of COVID. Therefore, it's not a question of absolute safety, it's a question of relative safety. We know that COVID can do horrible things to the body. So far, the vaccine has been tremendously safe. And therefore, if you want to play the percentages, you're much better off getting the vaccine, because we know that COVID-19, especially for high-risk individuals, can cause devastating consequences, including death. This may be near and dear to your heart. It may be because you have a child. It may be because you have a grandchild. And the answer is that it's extremely likely that in the next few months, the vaccine will get authorization to be given to children. There are currently large-scale vaccine trials going on across the country to be able to give this precious vaccine to the children. Everybody would like to know, okay, I paid my dues, I got the vaccine, I was able to overcome my concerns and my natural fears. Now can I go back to normal life? Not so fast, buddy. You have to wait until the rest of the country and the rest of your community and the rest of the world gets vaccinated. And we have to get close to herd immunity before we can go back to normal. Well, can I at least not wear a mask? That mask bothers me. It chafes my skins. I feel like I can't breathe. For that, I believe that actually within the next few months, we're going to get a definitive answer. And I believe that the answer will be that for most of us, we will not have to wear the mask. Really, the question is, once you get vaccinated, and even when you get immunized, we know that you are safe as an individual. We do not know at this point whether you're able to transmit the disease to others. So the virus may be living in your nose. It may be that when you sneeze, cough, or talk, you will give it to someone else, even though you won't be affected from it. However, it is looking with the preliminary data that it knocks out the ability to transmit this disease. So I believe that in the next few weeks to months, we'll be told that once you get immunity, you will not have to wear the mask. Some questions that I get and that are popular around the internet is, will the messenger RNA alter my genes? The answer is a definitive no. Everything that it does is temporary in order to generate an antibody immune response, and then there is no alteration of your DNA. The next question that I got yesterday, a police officer called me up and said, "Doc, my wife and I are thinking about starting a family. I want to know whether I should take the vaccine. How will it affect my fertility?" There is simply no data at all to suggest, and no scientific mechanism that would make it in any way likely that it affects one's fertility. It's another one of these myths that circulated around the internet with absolutely no scientific literature or data to support that. The last plug that I want to do is to speak about the need for the flu vaccine. If you get the flu vaccine, you have to wait 14 days between the flu vaccine and the COVID vaccine. I want to encourage you, if you haven't done so already, to get the flu vaccine, even though it has not really been a factor, thank God, in this winter. But it will decrease the chances of you dying from a flu-related disease if you're in the category of people who have heart disease, diabetes, or chronic lung issues. So I also want to just give a thank you to Megan McNutt, who has helped me tremendously with putting together what I think is a pretty wonderful deck. And with that, I'd like to open up to the audience for any questions.
Thank you, Dr. Geller. That was fantastic. I have a long list of questions here, so I've tried to group some of them together that are similar as well to make this simple. So one of the most common questions was around allergies, right? So are there any cases of people developing hives after an injection? Are individuals with peanut or food allergies more likely to have a reaction? What components of the vaccine could actually cause an allergic reaction? And, you know, what components in these vaccines are, what components these vaccines have so that people will be able to decide if they are allergic, and where can we get that information?
So the list of ingredients is actually a short list and it's available on the internet. The ingredient that most people think could be contributing to the allergy is polyethylene glycol. This is a preservative that's used in many everyday products. The rate of severe allergic reaction is extraordinarily low. It is still considered. So now we've given out millions and millions and millions of vaccines. We've seen extraordinarily few severe allergic reactions. You should notify your doctor if you've had severe life-threatening allergies to anything. If you're in that category, then your physician can advise you specifically as to the risks and benefits. Have there been hives? Absolutely. But again, hives are treatable. COVID-19 may not be. So yes, you should consult your physician, but it's only a concern for people who have had in the past severe life-threatening allergic reactions, also known as anaphylaxis.
Thank you. So do you think we'll have to be vaccinated regularly for COVID? Any insight as to how long these vaccines will provide immunity for?
So the best thinking about that is that it'll provide at least 1 year. Time will actually have to go on in order for us to see how long it really is going to last. Now, as far as will we have to get yearly vaccines? So the best minds in science at this point believe that while it may not be yearly, there will almost definitely be the need for booster vaccines. The mutations that we know about have caused a change in transmissibility, but the bigger concern is that there have been mutations along the spike protein. The spike protein is the target that all these vaccines have targeted, and it could be that in the future, we're going to successfully target a piece of the virus that does not mutate. The best example of a vaccine that has done so, and the most successful vaccine, we've ever had is the one for the smallpox vaccine. And while the smallpox virus mutates, the part that the vaccine is able to attack has not. So yes, I strongly believe that there will be a need for booster vaccines. I do not know whether it'll be on a yearly basis. So that's the best information that's out there for now.
Thank you. And what happens if you were unable to receive your second vaccine when it's a two-part process?
So at the time that you are able to get it, you should get it. There haven't been any studies as to the efficacy of it, how good the immune response will be for vaccines that have been given more than 6 weeks apart. But there will be some degree of immunity. It may not be as robust and it may be shorter lasting. But again, even if you were not able to get the second vaccine in the time period that's recommended, the current recommendation from the CDC is that you do get the second vaccine at the earliest possible time.
Okay, great. Doctor, could you comment on the CDC's communication regarding limiting the use of acetaminophen or ibuprofen due to its potential to depress the immune system's beneficial response to the vaccine?
So this is a theoretical consideration. We do not actually know whether or not and to what degree it could suppress the immune reaction. From a common sense point of view, any medicines that perhaps decrease inflammation may decrease some of the immune response. So for now, I would say that it's reasonable to either minimize or eliminate the use of these medicines. On the other hand, if you're suffering tremendously, I think that judicious use of either one is acceptable and will extremely likely not mitigate the immune response in the long term.
Okay. Is the vaccine harmful to someone awaiting a kidney transplant?
So somebody awaiting kidney transplant would in fact be in the category of people who should absolutely get the vaccine. They are at higher risk for having serious consequences. So I would flip the question and sort of say, not only would it not be harmful, but you're in the category of people who should be aggressively seeking it.
Thank you, doctor. And I know you spoke a little to this, but how do you recommend persuading someone to take the vaccine to those who are hesitant or skeptical of how effective it is?
That's a good question, and it's a question that's being circulated widely. I think that it's important to note that the leadership of our country has taken the vaccine in a public fashion. The medical leaders have taken the vaccine, and if you look at the people who are more vaccine hesitant, it is some groups that have historically had bad experience with the medical community. So it's very understandable that they are not as trusting. But I think it's important to note who is taking the vaccine and perhaps speak to the person also about the fact that they may be hesitant to take it because they don't know what the vaccine can do. But we know what COVID can do. We know that it can kill you. We know that it can cause kidney failure. We know that it can hospitalize you. So if you're looking to be safe, you really should be taking the vaccine, because if you're taking the chance and you're getting it, and even if you think that you're going to be a hero and that your body will be able to withstand it, if you get it, you can pass it on to others. And to be honest with you, I'd certainly feel awfully guilty if I got it when I had a chance to take a medicine to stop me, and then I gave it on to another person who may have given it to another person. So it's sort of a responsible community endeavor to stop the chain of transmission.
There was a question here on where you can get the vaccine in Westchester, seemingly impossible right now.
Yeah, I wish I had a better answer for that. For now, you have to go onto the Department of Health website. They have a phone number, they have a website. I know that I've personally been more successful with utilizing the website by going on it multiple times a day and just waiting for some site to get a refill. Once they get a refill, they start opening up appointments. And at this juncture, you simply have to go onto that site frequently and hope that you're lucky enough, to hit upon the right time.
And in line with that, does that site direct or share with people which vaccine is being given at each location? Is that shared?
I'm uncertain. I don't know.
Okay. So if somebody had caught COVID, how long after recuperating should they wait to get the vaccine? And another question related to that was if somebody was taking medication for cancer, how long do they need to be off their medication before receiving the vaccine?
They do not have to be off their medication to receive the vaccine. How long is a question that there is no tremendous data for, but the conventional wisdom is that you should no longer be in any way symptomatic before you get the vaccine.
Is there a need for spouses to get vaccinated together in any situation?
I mean, there's no need, but it makes sense kind of from the logistics and also from the safety of the household.
Okay, and what happens to the extra vaccines in a specific clinic that are not, I guess, I don't totally understand that question.
So
yeah, maybe used, yeah.
Yeah, so we've had situations that I'm familiar with that, let's say a vial of the Pfizer, for example, can get either 6 or 7 doses. And let's just say it's the end of the day and you've used 4 and now you have some left. But unfortunately, since it's been in room temperature for a period of time, it's not going, you can't sort of like refrigerate it. So there are times when these vaccines go to waste because the vials are multi-use vials. So this will be much less of a problem when we get to Johnson & Johnson as well as AstraZeneca, where the vaccines are just much more stable. But for the messenger RNA vaccines, I don't know about tragically, but I'm going to use the word tragically, some have to be wasted if there isn't somebody who is a candidate to get these vaccines.
Thank you, Doctor. And I've got one last question from the chat box, or it may be a question or a statement to clarify something you said, but I understood that people under 65 with underlying conditions were not yet eligible under 1C, and that the state is putting together a list of qualifying conditions.
Yeah, so they've publicly said that these are people who will be included, but they have not been included so far. So I believe that really within the next few weeks, they will be. I know that Maryland 2 days ago opened it up to this category already. So now that some states are already doing it, I hope to see the rest of the states being able to offer it as well. But that being said, while I do think that it's absolutely imperative that this group gets it, we're still facing a shortage with the current group. So it may be more of a theoretical positive development than a realistic one.
And I had one last one pop up, shingles vaccine. How soon can you get the shingles vaccine after the COVID vaccine?
14 days.
Okay, excellent. Those are the questions in the chat box. And if anybody wanted to ask one, I know we're running at 10 o'clock and the time is here. Jerry, you can pip in. But if there's any last questions for Dr. Geller, if you wanted to jump on yourself, you're welcome to.
Dr. Geller, thank you so very, very much for this very informative presentation. You gave us much to think about, much to consider, and we appreciate your time here today.
My pleasure and my honor. Thank you so much. All right, everybody, stay safe.
Bye-bye now. Thank you.
Bye.
Bye-bye.
Bye. Thank you.